Good morning. Today is May 6th, 2025. And presently right now, we're with the county health nurse who is Pam Hanna. And with that, I'm going to ask you to lead us off, Pam, on what's going on within your department, please.
Thank you. We have been busy. I usually start with a little bit of a MP report, some of the diseases we've been investigating. We are grateful to say that flu and COVID have slowed way down. So I'm hoping we're kind of seeing a decline on that respiratory season. We've had other illnesses that we've been investigating, other than the respiratory, and one of the biggest things that we've done is to be preparing in case there's measles, because Gallatin County, our neighbor, had 7 cases of measles. They first reported 5, and last week they reported 2 more, which were household contacts to the original 5, which fell right in that incubation period when we thought, you know, if something happened, it would happen. So we've been working with our medical providers and our schools and our stakeholders that would be directly affected if we should have a measles case. So we're really hoping that we're prepared and we don't have to use any of that preparation. So that's kept all of us pretty busy. Another thing that's been kind of significant right now is we've had some opportunities for some funding, which we're grateful for. So we were awarded the Near-Term Initiative 11 funding that is associated with House Bill 872, which is the Behavioral Health Systems for Future Generations. That's a mouthful. And that $300 million was approved by Governor Jim Forte in 2022. And they spent a couple years really looking at what to do with that money. They had a commission and that kind of traveled and talked to people, did a lot of research on how to use that. And I testified a couple of times related to that money, and that we'd really like some of it to go for prevention. As we look upstream, helping behavioral health that way is something that we'd like to do. So I became aware a couple months ago that there was some funding for small counties in Near-Term Initiative 11. So 8 small counties and 2 tribes could apply for that. The cap on population was 10,000, but I kind of did some asking because Jefferson County's almost at 13,000 now. We're a little over 12. And they said, no, apply. And so I applied. I wasn't really sure we'd be in the running because we were overpopulation, but we did get awarded that funding. So it's $250,000 over a 2-year period. And Dan and I have been working, Commissioner Hagerty and I have been working on getting all of that contract reviewed and signed. And I just got an email before I came here, Commissioner, that funding is ready to be distributed to us. We'll get our initial funds so that we can start looking at hiring. And because one of the things we want to do with that funding is to hire a behavioral health coordinator for Jefferson County to kind of work on some of the things we've already identified as needs. And those needs were identified in our community health assessment, and we put some strategies together in our community health improvement plan. One of the priorities was mental and behavioral health. So really, I was able to use a lot of what was in that document to apply for that grant. And then the other piece of that is to continue with the crisis diversion work we're doing, because Youth Sober Bowl has been helping us with that, but we only have 1 year of funding without them. So we kind of had identified hiring our own behavioral health coordinator for Jefferson County as a way to expand the work that we're doing. So
to do like what the guy does in Butte, to do like what the guy does in Butte.
Right, so this person would be similar to Bill in Butte and kind of help us. Something that's happening here in Jefferson County is that we're doing some collaborative work with both Butte, Silver Bowl and Lewis and Clark. So our behavioral health person would be kind of that liaison to advocate for Jefferson County in a regional aspect of both, attend those meetings, have a voice for us. And then do some of that boots on the ground work, with trainings and, education campaigns, those sorts of things. They work under me. And so some of that funding will also pay me. So that's gonna relieve our budget a little bit there. Not a lot of it, but some, I did allocate some funding to pay me for supervision of the grant and the behavioral health coordinator. So all of that funding will come through submittable. So there's another form I've got to get in there and look at from that email I got. So if I need signatures or something, I'll let you know. But I'll look at that and then they'll send out that first bit of funding, and I can't.
That's what I was gonna ask you, when it's going to become available.
Yeah, it'll come available as soon as we get it out, and it looks like. I don't have the final copy of the contract. This is the draft one that we reviewed. But there was a breakdown of the funding in that. And looks like that first allotment that comes with the signed contract is for $21,797.03. So I think as soon as I get that transfer taken care of, then we'll be looking for that money to come in. And then we'll also get another quarterly $23,000 for the first quarter. So we'll get paid on a quarterly basis for 2 years on a deliverable base. So if we haven't met these deliverables, we won't get the payment for it. So if we need them, then we get the full payment. So the whole schedule's in here. This, like I said, is a draft contract, but I'll make sure that you guys and Ginger have a.
So is there a check and balance so that they know that you can show them that you've accomplished this? How is it that you?
Yeah, that's the other reason I'm getting paid is I'm gonna have to build the deliverables for this. So I'm gonna have to do whatever reporting to the state needs to be done for these. We'll be keeping the data and the information. And so then there's all these different things that if we meet this much, we get this much. If we meet this deliverable, we get this much. So if we meet some of them, but not all of them, we get a partial payment, but hopefully we'll be able to meet all of them and get all the payment. So there's a full outline of what we have to do here. I don't know all of it yet, but I'm trying to learn. So we'll be tracking that and watching it. So thanks for your support in this. I'm both excited and humbled because it looks like a lot of work. But work that we're already doing, and now we have funding to help support that work. So I'm pretty excited about that. I will be meeting with my core CHIP committee next week. They're kind of my support group for what we're doing with the community health improvement plan. So we'll kind of be looking at this with them too, so that we can make sure we're moving forward with those objectives that we've got. And then, Commissioner Haggerty, I got an email yesterday about our IAP funding for our grant there. That one, we got a lot of extra money this year, but we're, that's the funding we lost. So we're gonna have back to what we had in 2023, which is $7,000+ for that. So you'll be seeing another DocuSign for that one. And I looked at it, I've asked him to change, I had Molly on as the liaison. I asked him to put me on as the liaison. So as soon as we get that contract back, I'll let you know, but there'll be.
Yeah, if you will, so when I see it come across, I can figure it out for you.
So you'll have to sign that one too,
Okay.
but that one's one of our foundational grants. And like I said, it's gonna be going back to where we were. I do have a budget meeting set up with Ginger next week too. Just to kind of see where I am with all of these monies, so that I can get going on my proposed budget for next year. So
Is this gonna create a new position? Is it gonna be a contract or just,
Well, it's gonna be a 2-year position, so I don't know how we're gonna look at that, but I'll be talking with Kelly too about it. We've got some grant funding, Kelly, that's gonna allow us to hire a position.
Oh, okay.
So, I'll need to set up a meeting with Kelly to, I've been kind of waiting till we had all of the contract and knew exactly what we needed to do. And then the other project I'm working on is the Pathways to Recognition project. And so with that, there's a specific way they want us to do some of that advertising, Kelly, with, it, in order to meet public health accreditation standards.
Mhm.
So we'll talk about that too, just some of the places we advertise and how we advertise is what they want us to document so that I can send it in to them, so as far as whether it's a contracted position or not, I don't know what that looks like, Craig, because it isn't a long-term position. It's, when this funding runs out, unless we find other funding, we wouldn't be able to sustain this
Right.
position, so. We'll see what that looks like. Part of what I had to write into this grant is how we do sustain this project. And so there are some goals related to sustainability. And some of that is gonna be collecting data and seeing, what happens with this position and if there are other ways we can,
could it work into more funding in the future, or we just don't know at this point?
well, I'm hopeful that there will be more funding in the future, and there's lots of different places to look for that, so that will probably also be part of what this behavioral health coordinator is doing is, and we can also engage like Leah, because we do have a grant administrator here in the county. I think we kind of get Leah involved in some of this too, and that was one of the things I wrote into the objectives was, to make it sustainable, we look for other funding. I mean, when we did the simulated, the sim mapping project that we did with the contractor for crisis diversion, that was resoundingly what everybody said, for one of our challenges in creating sustainability was funding, and we all know that, so if we've identified it, I think part of it for us in the health department is we're gonna be putting that into our strategic planning. So that, it's something that we're focusing on is looking at funding opportunities. So. And that's the other thing we're working on, is strategic planning and rebranding. You'll notice when you get an email from me that we've done a new logo. This is kind of part of that Pathways to Recognition process that we're doing too. So all of my staff will have kind of the same email signature. We'll have it on our letterhead. We'll have it on our tags. Just when you see that, you're gonna know it's Jefferson County Public Health. So is the point. In our staff meeting this morning, we talked about our events for the next few months. Summer's kind of our big event season. And as you remember, I had all my staff go to incident command training, ICS training in January. And so we're going to use that ICS model for planning all our events so that we kind of have some experience and use with that model, so that should we need to use it again like we did for the pandemic, that it's a little more natural for us and we kind of know how to use it. So we kind of made a plan for that. So our next event will be Clancy Days in June, and then we'll do Frontier Days in July, and the fair in August, which gives us one big event in each of the 3 geographical locations of the county. And then we'll also do 3 farmers markets here during the summer, just gives us some exposure. And we have a couple of caravan events coming up. So all of those events, we're gonna do ICS structure to do the planning piece of it. We just had a pretty successful health and safety fair at both Jefferson High and, Whitehall High, and I think in looking at the after action on those, had we done the ICS structure with those, it could have, helped with a couple of kinks we had, so we're gonna use it going forward.
Is Jesse involved with your ICS part of it, training, or is he just strictly off the side of the safety aspect of it? He's under you, right?
Yeah,
So
yeah.
is he involved? with
So
it?
Jesse will be our commander, our ICS man chief, and then we'll all take turns doing different portions, you know, operations and logistics and those sorts of things, just so that we kind of have our wheelhouse. One of the struggles I really had with the pandemic with ICS is that the model started with fire and it's adapted to other things, but it really doesn't fit a medical emergency very well, and we struggled with that, so I'm trying to figure out how we learn how to use that process in a way that works for us, so that we can be more effective and efficient if we should have to use it again, so.
there's an ICS, I think it's 300. That's geared towards medical stuff in hospitals, if you wanna look at that.
So we did the ICS 300 out at Fort Harrison, and it wasn't geared to, it was, you know, we had fire and law enforcement there, but there were quite a few public health people there. And that was the discussion we had, is that, you know, how do we adapt this to healthcare? But I didn't know that there was a healthcare one.
I'm sure that there is. I thought it was 300, but it might be something different. At least when I went to it at the hospital. That's where they
Did
had
you?
it. And it
Well,
was,
I know the Healthcare Foundation does ICS training. In fact, they're always doing it. And the next one I need to take is 400. When we started the health department, we have to have 1, 2, and 7. That's part of our onboarding.
Yep.
And I'm trying to and then with our FEP grant, we're trying to add to that. Somebody every year takes a different training or does a recertification type thing. So I'm gonna have to do 400 next year, which is also an in-person one. So I might look and see if I can find one that's through a hospital. And that's a good idea. So, yeah, thanks for that. I know you guys have all done the ICS stuff, but it's kind of, my nurses still aren't happy. I'm trying to figure out how we can use it. So anyway. So I think those were our big things. Molly is teaching Clancy Schools staff. I think 20 members of their staff are gonna be trained in CPR in June. That is one of the ways we've used our FEP funds. Most of our FEP funds pay Jesse, but one of the things we've dedicated additional FEP funds for right now is teaching CPR. Just without the hospital and the ED here in Jefferson County, we've really identified that, you know, EMS is, you know, it's our first responders, and if we can have bystanders, community members that know, it helps us to have better outcomes. So we've been doing a lot of that. She's taught, I don't know, I'm gonna have to do a total, but she's taught multiple classes during this year. So it's really kind of nice to have Molly's ability to do that training, and we'll most likely dedicate extra FEP funds for that next year too, because we do have the schools on board to be trained every year, every other year. So it's a good partnership too that we've built with them. So we have caravans this week for adolescent clinics. We haven't had a huge super turnout for them, so we're a little disappointed in that. I'm gonna kind of be looking at, we used to have great caravan clinics before the pandemic, and I don't know if we need to have another approach or what we need to do differently. So I'm gonna talk with the caravan administrators, see what they're seeing in other jurisdictions, and kind of look at how we make an improvement with what we're doing there.
So how does measles work? Is it as bad as COVID as far as being contagious? Like, can a kid with measles go to class and like infect everybody around them and not even show symptoms, or?
You know, it's kind of hard to do a comparison to comparison, but measles is our most contagious disease that we know. The R naught for it is like a 9, which is really high. So, and part of it is that they can be contagious before they know. So they're contagious 4 days before the rash appears. The rash usually comes a couple days after they have those prodromal symptoms, which are fever and, you know, respiratory stuff. And then they're also contagious for 4 days after the rash appears. So there's that 8-day, you know, period where they're very contagious, to the point that if they're in a room and it's airborne, if they're in a room and somebody passes through that room who's not immune, 95% of them will get it, and for 2 hours after that person has been there.
That's amazing.
So it's a pretty big thing. But the good news with measles is that if you are immune, either have had the virus or vaccinated effectively, there's 93% coverage for first vaccine and 97, and it's lifetime. You don't need a booster for it. So the thing is, and that's what we're promoting, is if you don't know your immune status, please talk to us, because if you're immune, that's very slim chance that you're gonna get infected.
And you
But
can,
for
you can
those who
test that,
aren't-
can you, with something?
What's that?
You can test whether, like,
You
they're,
can have a titer done,
Yeah.
and that will check, and I've heard anywhere from $30 for a titer to $300, so it kind of
Wow.
depends on where,
I
so I
like
would
that.
check. I mean,
Mhm.
honestly, it's cheaper for us to give you a vaccine than it is to get titer
check if you've had it or not.
in most cases. So anybody born before 1957 is considered immune, because we didn't have a vaccine until the 60s. So most of those people have it. And then, you know, adults, we want them to have at least one vaccine on board, unless they're healthcare providers or they're traveling to someplace where they've got it. Kiddos, it's 2 vaccines appropriately spaced to be able to be fully. So that's the scoop on measles. So yeah, it's an ugly one and we don't want it here. Yeah. The other issue we have, or with some of the laws, is, you know, knowing how we can isolate and quarantine is been challenged with some of the changes to legislation. So I think Jim Murphy will be talking with Steve about exactly what to do about.
Great. Sounds like you're busy enough.
Yeah.
You're right. Well, thank you. Anything else?
Well, thank you. Appreciate it.
Good job.
This is your insurance meeting. Huh?
Yep. We're working with Megan here on the replacement, we have that conversation.
Well, thank you. Yeah.
That's gonna be a tough shoe. to fill.
It's gonna be a really tough one, and if you want, Kelly, there were a couple of suggestions for sanitarians for advertising. Because there's so few and far between. There's a couple of sites, and the University of Montana is actually trying to recruit sanitarians.
Oh.
So we might be able to get it on some of their.
According to Megan, somebody,
You're done,
I don't know,
right?
her,
Yeah.
headed out to all 136
Oh,
county websites or something to get, I've already had 2
Good.
people, licensed sanitarians, ask about it. So there's hope. There's hope.
All right. Are we done, Mr. Chairman, with this
well,
one?
we are. Yes, thank you.